Hello, my name is Tyrell. I'm an exercise physiologist and a corrective exercise specialist. Today I'm going to talk with you about self-myofascial release. Self-myofascial release is a flexibility technique used to inhibit overactive fibers. Overactive fibers typically occur from poor posture and repetitive movements. These are seen typically at work, or driving a car, or even at the gym. These movements create dysfunctions within the connective tissue of the human movement system, which creates dysfunctions which the body treats as injuries and will try to self-repair. Trauma to the body or the human tissue creates inflammation, which activates the body's pain receptors. Then the body initiates a protective mechanism, increasing muscle tension, causing muscle spasms. These muscle spasms cause knots, or as we call them, trigger points. They will begin to form in the soft tissue and form weak, inelastic matrices that decrease normal elasticity of the soft tissue. Weak inelastic tissue is tissue that's unable to stretch. Normal elasticity is tissue that is able to stretch. When this occurs, left unchecked, these knots will form permanent structural change in the soft tissue. The soft tissue remodels itself with inelastic collagen matrix that forms in random fashions. When the muscle fibers are lengthened, inelastic connective tissue fibers act as roadblocks, not allowing muscle fibers to move properly. Basically, it does not run in the same direction as the muscle fibers. Self-myofascial techniques help release the microspasms that develop in traumatized tissue and breaks up fascial adhesions. This improves the tissue's ability to lengthen through stretching techniques. Basically, myofascial release is an external pressure which stimulates receptors located throughout the muscle, the fascia, and the connective tissue, which overrides dysfunction caused by commutative injuries. Self-myofascial release is also known as SMR, the abbreviation, which stimulates receptors through sustained pressure at specific intensity, amount, and duration to produce an inhibitory response in the muscles, which alleviates side effects of active or inactive trigger points also known as knots. As stated earlier, self-myofascial release is an external pressure, which should be used at a high intensity, which is max pain for a low duration of 30 seconds, or at a low intensity, which is minimum pain for longer durations, typically 90 seconds. This will significantly reduce pain at trigger points. With the application of SMR, self-myofascial release, the pressure and tension on the muscle has a positive effect on the autonomic nervous system, which increases vasodilation to the tissues, which can receive oxygen, nutrients, and remove waste to facilitate tissue recovery and repair. It provides better muscular contraction and joint motions, as well as decreased faulty contractions of the muscle tissue that leads to injury. It also better oxygenates the blood and decreases feelings of anxiety and fatigue. Key application points of self-myofascial release. Make sure the client maintains proper alignment while performing SMR. For example, when foam rolling the calf, the client may cross the free leg over the treated leg to increase pressure, or keep the legs uncrossed to decrease pressure. The client should roll the device over the treated area slowly. The client should not roll the device over the treated area fast. You do not want to excite the muscle. The goal here is to inhibit the overactive tissue. Instruct the client to relax and not tighten up while working the specific area. Tension in the area being treated will prevent the roller from penetrating into the deeper layer of the soft tissue. Areas that have myofascial restrictions will be more painful to mobilize. As soft tissue restrictions break down with subsequent sessions, treatment will become less painful for the client. Precautions and contraindications. SMR should be cautioned or avoided by people with congestive heart failure, kidney failure, or even organ failure such as liver, pancreas, bleeding disorders, and contagious skin conditioning. There are no known reasons for self-myofascial that cannot be performed on a daily basis. It all depends on the client, if he's healthy or if he isn't, as stated with the precautions and contraindications. Basically, it's determined by the client. One set per knotted body region would be significant, or body part of choice. Again, one should hold the foam roller on the tender portion for roughly 30 seconds at high intensity, or hold it on the area that's tender for 90 seconds for low intensity. Then moving on to the next region of the body. So while using the self-myofascial roller, the frequency can be on a daily basis. It just depends on the individual. You should do one set, again, for either 30 seconds at high intensity or 90 seconds at low intensity. Again, hold on a tender spot. 30 seconds high intensity, 90 seconds low intensity. Next, I'm going to show you a brief video of a young lady doing self-myofascial release with a foam roller.